Assalamu alaikum viewers. Let's talk about the cholesterol test. If you are going through a cholesterol test, what are the steps and what are the conditions which you need to know more about it? And when the test result comes, how to read your test? Let's go ahead. A complete cholesterol test, also called a lipid panel, a lipid profile, is a blood test that can measure the amount of the cholesterol and triglycerides in your blood. A cholesterol test can help determine your risk of the buildup of fatty deposits, plaques in your arteries that can lead to narrowed or blocked arteries throughout your body. A cholesterol test is an important tool. A high cholesterol levels often a significant risk factor for the coronary artery diseases. Why it's done? A high cholesterol usually causes no signs or symptoms. A complete cholesterol test is done to determine whether your cholesterol is high or to estimate your risk of heart attacks and other forms of heart diseases and diseases of the blood vessels. Why it's done? Total cholesterol, this is a sum of the blood's cholesterol content, and low density lipoprotein means LDL cholesterol. This is called the bad cholesterol. Too much of it in your blood causes the buildup of fatty deposits. Too much of in your blood means you need to understand it's not a good sign for you. You need to take care of it, which reduces the blood flow. These plaques sometimes ruptures and can lead to a heart attack or a stroke. A high density lipoprotein cholesterol, HDL. This is called the good cholesterol because it helps carry away LDL cholesterol, thus keeping arteries open and your blood flowing more freely. Triglycerides, the fourth part of the test. Triglycerides are a type of fat in the blood. When you eat, your body converts calories it doesn't need into triglycerides, which are stored in the fat cells. High triglycerides levels are associated with the several factors, including being overweight, eating too many sweets or drinking too much alcohol, smoking, being sedentary, or having diabetes with elevated blood sugar. Why should get a cholesterol test? According to the National Heart, Lung and the Blood Institute, a person's first cholesterol screening should occur between the ages of 9 and 11 and then be repeated every 5 years after that. The NHLBI recommends that cholesterol screening occurs every 1 to 2 years for men ages 45 to 65 and for women ages 55 to 65. People over 65 should receive cholesterol tests annually. More frequent tests might be needed if your initial test results are abnormal. If you already have a coronary artery disease, you are taking cholesterol lowering medications, or you are at higher risk of coronary artery disease because you have a family history of high cholesterol or a heart attack. If you are overweight, if you have a diabetes, if you smoke cigarettes, or if you are physically inactive or eat unhealthy foods. People undergoing treatment for high cholesterol require regular cholesterol testing to monitor the effectiveness of their treatments. Is there any risk for this test? There is a little risk in getting a cholesterol test that you might have a soreness or the tenderness around the site where your blood is drawn. Really, the site can become infected. How you prepare yourself for the test? You are generally required to fast, consuming no food, liquids other than water for 9 to 12 hours before the test. Some cholesterol tests don't require fasting, so follow your doctor's instructions. What you can expect during the procedure. A cholesterol test is a blood test usually done in the morning. If you fast overnight, blood is drawn from a vein, usually from your arm. Before the needle is inserted, the puncture site is cleaned with the antiseptic and an elastic band is wrapped around your arm. This causes a vein in your blood to fill with the blood. So after the needle is inserted, a small amount of the blood is collected into a vial or syringe, and the band is then removed to restore the circulation, and blood continues to flow into the vial. Once enough blood is collected, the needle is removed and the puncture site is covered with the bandage. The procedure will take a couple of minutes. Is relatively painless actually. After the procedure, there are no precautions you need to take care. After the cholesterol test, you should be able to drive yourself home, do all your normal activities. And if you have been fasting, you might want to bring a snack to eat after you have a cholesterol test. All right, what after getting the result, how you should read it. In the United States, cholesterol levels are measured in the milligrams of cholesterol per deciliter DL of the blood, but in Canada and in Europe it's a different measure in the millimoles per liter, means mmol by L. To interpret your test result, use these general guidelines. All right, for the first thing, total cholesterol, if your result is less than 200 milligram, it's desirable. If it's between 200 to 239, it's a borderline. If it's 240 or above, it's considered as a high cholesterol. Okay, and for the LDL, you need to take care about the LDL below 70 milligram. Best for the people who have a coronary artery disease, including a history of the heart attacks, angina, or having stents or coronary bypass. And if your result is below 100 milligram by DL, optimal for the people at risk of coronary artery diseases or who have a history of diabetes. Near optimal for the people with the uncomplicated coronary artery diseases. 100 to 129 milligram by DLL. Near optimal if there is a no coronary artery disease, high if there is a coronary artery disease. And between 130 to 159 borderline, high if there is no coronary artery disease, high if there is a coronary artery disease. And 160 to 189, high if there is no coronary artery disease, very high if there is a coronary artery disease. And all above 190 milligram, all are considered are very high for a normal person or for a person with any artery diseases. Okay, how we read HDL? Good, it means a good cholesterol. Below 40 milligram by DL in a man is a poor, means it's not good, should be more. And below 50 milligram in women, it's considered as a poor. 40 to 59 in men, it considered is a better result, and 50 to 59 in women considered as a better. And 60 milligram above is considered as the best result, so you are good. And what about the triglycerides? Let's talk about it. Below 150 milligram is desirable, is good if your result is below 150, and 150 to 199 considered as a borderline, 200 to 499 is high, and 500 milligram by DL and above considered as a very high. I hope this video is going to help you to read, interpret your cholesterol test. Hope it finds good for you. All right, keep it up. Have a good day. Remember us in your prayers. Thanks a lot for watching. Thanks and goodbye.